Welcome to the podcast. Today we have a special guest and a great topic of nitric oxide in the body and how it relates to sexual function. So, Greg, do you want to go ahead and introduce yourself?
Sure. Thank you so much. My name is Greg McEtrick. I am a pharmacist. Um, I am director of urology, OBGYN, and hormone therapies for Revelation Pharma, which is a nationwide group of compounding pharmacies. I'm also on the scientific advisory board for Berkeley Life Nitric Oxide. Been a pharmacist for about 32 years, so been around for a while.
Lots of experience and
Oh,
knowledge. We love
welcome.
that. I
Yes.
know. So,
Absolutely.
well, Faraday and I were discussing, it seems like every time we hit the nitric oxide, topic again, that there's so much to learn. It's almost like you're learning it again because there's so many details there.
Sure.
And, the research is just developing at rapid speeds. And so we have trouble keeping up. So we would love to hear more about nitric oxide from you and your take on it and how it relates to aging and also function and performance in the body. So
maybe we can just kind of break it down from the beginning, go over a quick overview of how it's made in the body and how it's utilized by the body.
basically starting with nitric oxide.
So,
So a
go ahead.
little, just to let our listeners and viewers hear a little bit more again about the basics of nitric oxide production in the body.
So nitric oxide is what's called an essential gas in our system. Our body produces it, and it is kind of our natural vasodilator. Really maintains blood flow throughout our entire system. So it's intrinsic to essentially every metabolic function in the body. Giving a little history, over 20 years ago, there was a Nobel Prize awarded to the research done on nitric oxide and its impact on cardiac function. So it's been a mainstay and very, very well publicized for a long time. Now it's really come into vogue in greater conversation, I'd say, within the last 6 years pertaining to sexual function. So from a physiological standpoint, when we're 18, 20 years old, it's in full supply in our systems, absolutely no problem, just like our natural hormone production, testosterone levels, everything else. When there is sexual arousal, there's a hormonal response that triggers the endothelial tissue to release the nitric oxide. This allows the blood vessels to relax and increases circulatory function. So for men, that means erectile function. For women, that means clitoral engorgement and engorgement of vaginal tissue. Also for women, you do tend to see a spike in oxytocin production with it. So that's all great. By the age of 40, and that actually is variable based on diet and stress and environment, but by the age of 40, we typically see endogenous nitric oxide production dropping down to about 50%. By the age of 60, we're talking about 15%. And again, there are medications and sociological factors and environmental factors and disease states that really cause that to drop
Make
even
that more
further.
rapid. Huh?
So, yep. So significant drop off as we're aging, and you think in terms of when are we starting to see issues with decline in hormone levels, decline in sexual function, cardiac issues, on and on and on. So again, very, very intrinsic to our system and our metabolic health.
Okay.
I think you hit on something really great. We focus on men when it comes to nitric oxide, and we don't talk as much for women, but this nitric oxide is fantastic for both when we're looking at sexual wellness. What about when our younger guys that are talking about amino acids and utilizing aminos to get that nitric oxide conversion? You kind of hit on how those pathways decline. Is that affected as well by the source in which we get our nitric oxide conversion?
So for young guys and young women, for that matter, if they're 35 years old or younger, that's perfectly fine. And you'll see majority of the nitric oxide products that are out on the market are going to be amino acid based. You're going to see a lot of L-arginine and citrulline, pycnogenol. And if you go to GNC and you pull something off the shelf, it's also going to have a bunch of other stuff in there too, the caffeine and niacin and things like that. They make you certainly feel something. The problem is,
give you a boost.
Yeah, The conversion from L-arginine to endogenous nitric oxide goes through a pathway, and it's called nitric oxide synthase, or NOS.
Mm-hmm.
That pathway tends to break down about the same time our natural production is becoming a real deficit. So what that means is someone who's relying on an amino acid-based formula as they're aging, and when I say aging, I mean, hey, if we get into that 45 and up window, their conversion to systemic nitric oxide is not going to be very effective.
Mm-hmm.
Therefore, using a dietary form instead of an amino acid-based product, something that does not have to go through NOS, the conversion process to become systemic nitric oxide, it holds great advantages for the population of patients that we deal with. The nice thing is it's actually effective for all age groups. So
Mm-hmm.
it's really not age related whatsoever. It just so happens that majority of the products out there are very age related.
Because those are dependent upon that amino acid conversion with the NOS pathway. So
Right.
it sounds like, you know, you have a dietary pathway for nitric oxide production and you have an amino acid pathway. The amino acid one declines in function when you age, and the dietary one is not dependent on that enzyme, that
Right.
same enzyme for conversion.
That's exactly correct. And you know, one of the things that I always talk with patients about is, boy, you know, you could do a lot of this through diet.
Right.
So, you
Food's
know,
high
you
in
can
nitrates.
eat exactly. The problem is
Mm-hmm.
the standard American diet, or you know, what it's called is
Mm-hmm.
the SAD diet,
Mm-hmm.
just doesn't provide that. We don't eat that way. So when I talk to patients and I explain to them, I said, boy, we could do this in a dietary manner, and I give them the menu. It is 99% of the time just the kind of curled up eyebrows going, yeah, that's not going to happen.
Yeah.
So when you can offer a dietary nitrate and you're looking at a couple of capsules a day, that
Mm-hmm.
is 100% going to be the path that the patients choose.
So, say if we're looking at spinach and beets, which are a good source of
Yep.
nitrates,
We're
how
looking
much
about
would they
five
have to?
ounces intake. Five
Yeah.
ounce.
Daily.
And and I'm referring basically to a direct conversion from the Berkeley Life nitric
Mm-hmm.
oxide. 2 capsules of that correlates to 5 ounces of fresh spinach, not
Mm-hmm.
boiled down spinach, not,
Mm-hmm.
you know, baked out spinach, but fresh spinach.
Mm-hmm.
And again, you get the same thing with a healthy dose of beets, arugula, cucumbers have a lot of nitric oxide, a lot of nitrates in them. So there's other ways of doing it, but you're talking a sizable amount.
Mm-hmm.
And most people
Daily.
just don't take yes,
Yeah.
exactly. And most people just don't do that.
Yes. Well, and then you're talking about even like the source of food, you know, so even if they think
Sure.
they're doing that, are they really doing it? And if they're cooking it, are they getting it? And again,
Right.
our sources and pesticides. So this
Yes.
Berkeley Life, you know, it's been a huge, you know, hit with our men. And again, we'll talk about the female aspect of that as well. But so Berkeley Life is a supplement that you have been a huge part in, the Berkeley Life, you know, scientific advisory board, right? And so how does that work exactly? So there's 2 capsules that they're taking each day.
Mhm.
Mm-hmm.
Right.
And
Some people will actually take more, but yeah. And again, I met up with the folks from Berkeley Life about 6 years ago,
mhm.
and their focus, like I said, was primarily cardiac function. I saw number one, their product. Number two, that patented saliva test.
Oh yes,
Their
yeah.
test
Yeah, the test
strip,
strips are pretty awesome.
Mm-hmm.
the on-hand ability to test somebody immediately on site. 10 seconds later, you're giving them a significant reading in terms of what their levels are. That then allows you to introduce this whole conversation. If you're talking to a guy and you can literally do a 10-second test, show them their level, explain the correlation between erectile function, blood flow, the capacity for medicines like Viagra and Cialis, Levitra, the PDE5s, to be effective,
Mm-hmm.
and how this natural decline occurs over time. And you know, one of the things that's very commonly known, you know, again, I'm going to pick on Viagra because it's been around the longest, but you know, for about 65 to 70% of men, Viagra is effective. However, it's only effective typically for about 5 years. So correlate this to, what we've discussed in terms of the physiological pathway. When they're starting on Viagra, they are really already in decline in terms of their nitric oxide production.
Mm-hmm.
So 5 years later, where are we sitting? Well, at that point, what happens is there's just, and I use a lot of correlation, but there's no gas in the tank.
Yeah.
Mm-hmm.
There's nothing left there. If there's nothing left there for that PDE5 to really function with, you're not going to see the same response.
Yes.
And
Yes.
this is where you start to get the failures.
We've seen a lot of patients come off like daily low dose Cialis with nitric oxide supplementation instead.
Mhm.
So we're getting a great response from patients on a continuous basis. So it makes sense why this has become such a hot topic and why
Correct.
guys are seeking it out and wanting to know more. What about those guys that are still taking their Cialis every day and taking nitric oxide on top of that? Do you tell your patients not to utilize both or to go ahead? We've kind of heard a little bit of difference from two different people, so I like to get your take on that.
There's absolutely no reason whatsoever not to take both, unless they are experiencing side effects due to, again, this increased blood flow, which, again, PDE5s have their own whole set of side effects that go along with them.
Yes.
Viagra, headache, vision, stuffy nose. Citalopil or Cialis, you get the heartburn. You still get some of the flushing and palpitations. Levitra, much less. So if you increase the effectiveness of that medication, you will see typically an increase in the side effects. Guys who are not getting a full response from that PDE5, though, absolutely have to be on something like this because it's going to fuel it. And just to give you even a clearer picture of this, the progression in terms of erectile dysfunction, you go from supplementation to PDE5s. Typically, the next step is what's called the penile injections, which are like trimixes and that sort of thing. I actually had patients converting off of injections, going back to oral or sublingual PDE5 therapy because of the nitric oxide, because of the Berkeley Light. You talk about a significant benefit in your patient population. If you can get somebody off of injections and start to restore that natural response, you're going to be a hero to them forever.
So on these patients with the test strips, we see a pretty immediate response in color change. For the guys that are utilizing these daily, taking their 2 capsules every day, how quickly would they see a sustained response in sexual function after starting?
And again, once this is in the system, it's in the system. So you don't have to take it for weeks for it to build up. 90 minutes after taking a dose, you can typically see the dramatic change in the salivary nitrate levels. And that gives you a very good indication of what the systemic is. So this can boost very quickly that endogenous nitric oxide load. So again, it's not something where I get a lot of patients say, well, I tested and then I took it and I tested good after that. How often do I have to test? So, well, you've basically already answered your own question. You're taking it, you got a good result on the test. Unless you start doing something completely different. And again, there can be factors. There's certainly mitigating factors. Certain medications can impede nitric oxide production and will have some effect. Even, mouthwash, because it eradicates the enzymes in the mucosal tissue. So again, there's other things, but really and truly, this is very rapid acting, and the benefits of it. I know we talk about sexual function a lot, but the benefits of it are really systemic. Every metabolic function of the body,
every organ dependent on blood flow is affected.
Exactly.
Well, we're looking at like what you've talked about so far, again, is traditional medicine and writing, prescription, sometimes not telling them. That's been a big, huge missing piece of information, telling them how to take that, but also discussing dietary effects and decreasing with age and how to boost it. And then again, when the little blue pill stops working, the next is, injections like you've talked about. And yet there's that missing piece of information that men right now tend to be looking for. Women are starting to, again, it's just not been as, I think, talked about with women's, health. And so that, again, they have the same pathways, the same organs, they need blood flow too. And so you guys are not recommending anything different for women when it comes to Berkeley Life.
Nope. And, I very commonly use the explanation. I said, the parts might be different, but the plumbing's the same.
Yeah.
Exactly.
So when you talk about the ability to increase blood flow, increase clitoral engorgement and sensitivity, increase natural lubrication due to better circulatory function and tissue health, these are all factors that are going to play, and women will benefit. There's just no other way to say it. And in my practice, we will use PDE5 therapy with women. We'll incorporate other things like apomorphine. So I mean, there's a number of ways that you can enhance this, but at the core of this really is that nitric oxide supply, because that's going to dictate that venodilation, the ability to get the blood flow.
Is there a timing that you guys usually recommend? This is a common question, actually.
Yep.
So
like I tell guys in the morning, but
with both. And is there a timing with their PD5 inhibitors that they need to do Berkeley Life at the same time in the morning? What do you typically recommend?
I basically structure therapy around lifestyle. So if I have somebody who comes in and says, boy, the only time I ever have sex is 10 o'clock at night or later, or 9 o'clock at night or later, I'm not going to steer them to take medication at 7 o'clock in the morning. Because again, let's just say they're on a daily Cialis. Okay, so Cialis, realistically, it takes 3 to 4 hours for that really to get into the system, to really be fully absorbed. I know advertising tells you take it 30 minutes before, and I can't tell you how many times I've gotten a phone call from patients who used Cialis or Tadalafil, and they said, well, yeah, I got an erection at 6 o'clock in the morning, but not at 11 o'clock at night when I needed it. So timing these things, if you're only a later evening person, we'll take before dinner. The nitric oxide is going to take 90 minutes, maybe 2 hours tops to really get in your system. You can take those at the same time. You're still going to have a good load of the nitric oxide. Now, if you're, more of an early person in the day, a morning person, or you like your nooners, absolutely take it in the morning. But again, structure that around what your activity style is. What's your typical day, and when are you sexually active?
Do you do any combination of the PD5s with people?
Yeah, we do tremendous. So very commonly, and again, I'm a compounding pharmacist.
Yes,
so
correct. Yeah.
With what we use, we typically lean on more of the sublingual dosage forms, and for great reasons. Tablets are wonderful, but tablets are interfered by stomach content. Tablets go through first pass metabolism. The first pass through, and they get through the liver, and you've lost a third of that medication before it hits the bloodstream. And then the time to effectiveness, like I mentioned. So a lot of the times we'll combine maybe a daily dose Cialis with a sublingual sildenafil. Why? Well, because if you're taking the daily dose Cialis, that's going to be in the system anyway. You don't have to rely on the sublingual version. But then, if they still need a little bump, don't give them a Viagra tablet that, if you're going out to dinner on Friday night and then think you're going to take that and get an effect, forget it. It's not going to happen. Even if it does, it's an hour later. Whereas a sublingual, like what's called a troche, or rapid dissolve tablet, there's different versions, but it's absorbed through the oral mucosa, under the tongue or in the buccal area. So it goes directly into the bloodstream. So you're talking about absorption rates 4 times as fast as a tablet. You're talking about bioavailability into the bloodstream, 25 to 35% higher than a tablet. So again, we can combine different PDE5s into a single troche dose. We can combine things I mentioned, apomorphine. You can combine oxytocin.
That's what I was going to ask. Were you doing oxytocin as a troche as well?
Yeah. Low dose naltrexone is great for sexual function. So all of those things we can combine. Help for a lot of guys. We'll combine testosterone in there if they need a boost, because sublingual testosterone, very rapid acting, very rapidly metabolized, great for that date night.
Yeah, or workout, pre-workout.
Yep.
Pre-workout, pre-sex. And again, I think one of the big missing pieces with primary care, and just to drive that point home, is if they're taking it orally on an empty stomach,
Mm-hmm.
is key.
Yes.
And then of course doing that because they weren't told that, and it's a huge, not misinformation, but just lack of information.
Just a missing part of education.
Yeah, when the primary cares are writing it, and then also then adding this because now you have the dietary,
Right.
With the nitric
nutrients,
oxide. Mm-hmm.
to increase it. So, with that being said, with Berkeley Life versus other supplements that might do the same, have you seen anything that you've seen the results with that you have with Berkeley Life?
There are similar products, but the thing about the Berkeley Life, number one, compared to anything else that we have worked with, it has a longer half-life,
Mm-hmm.
which means that one time a day dose is going to carry you further. The other thing, I worked, it's probably 10 or 12 different nitric oxide boosters prior to landing with Berkeley
Mm-hmm.
Life. A lot of them were the amino acid based.
Mm-hmm.
Never saw the kind of function that we get with the Berkeley Life.
Mm-hmm.
Even the products that are out there that have similar components to Berkeley, and again, I'm all about taking care of the patient, so economics is part of that.
Mm-hmm.
Other products, they can be twice the cost.
Yeah. Yes.
Okay.
As what you're looking at with Berkeley, and that's a huge factor for patients.
Mm-hmm.
Yes.
And I love the test strips are key, like giving them objective information. We're going to actually
Yes.
add that into probably just some vitals when we're bringing them in, both men and women, so they're aware.
Yep. And if
Especially
anyone's
for
listening and
HRT.
wants it,
Yeah.
they can come to our website and get it.
Yeah. We have that on the website, and there'll be a link in the show notes too for Berkeley Life products, because we frequently are talking about them and then asked where they can find them. Anything else that you would like to add? I know you do a lot of sexual wellness, and again, we do that too, so comprehensively. You're addressing it in other ways, which I love, in both men and women.
Mhm.
I love the
Sure.
fact that they can think about that PD5 inhibitor and
Yes.
Berkeley Life as well for the partners of anyone listening or the women listening. Anything else that you would want to cover or touch upon before we ended today?
Well, there are so many things,
I
and
know.
again,
Yeah.
one of the nice things about the world that I work in is there's always new information. There's always new material to look at, and that's why some of these things that I start mentioning about the different components and different active ingredients, somebody who's listening to this might just sit back and scratch their head going, I've never even heard of that. I don't know how it functions. And I certainly would welcome anyone that's looking for more information. We've at Revelation, we have a lot of that on our website. We've got a lot of
Good.
accessible information for patients, and we have a lot of clinical people who can really help with that.
Mm-hmm.
The other thing about it is communicate, talk. There's unfortunately, sex is not something that is openly discussed, and I think that it's really underserved in terms of our ability to communicate with patients. It is vital to quality of life. It's vital to longevity. It's vital to intimacy and sustaining marriages and relationships. So this should be a key component. For all intents and purposes, as much as we hear about the trouble with economy right now in our country, we should be talking about intimacy and sexual function and how we can maintain this quality of life, because that is something that it's never going to go away.
Correct.
Absolutely. We couldn't agree more.
Yeah. No, we love bringing couples back together when we can approach it from the female standpoint, and they come to us first, or the men, and then frequently they're bringing in the partner or the spouse. And so we love that. Bringing couples back together is, so rewarding in this field. So
Absolutely.
it'll only get better with
Absolutely.
time, right, Greg? It's only
That's
gonna We're only gonna cover
With
it
more
more. We're only
research.
gonna open more conversations. So, well, thank you for being with us right now. So Revelation Pharma, but you're with Stanley RX too, right?
So Stanley is a part. Stanley became part of Revelation.
Okay.
So yes, for the last decade I've been working with Stanley, but now I am actually part of Revelation Pharma.
Okay, gotcha.
I am, again, for Revelation, I'm director of urology, OBGYN, and hormones. We have specialists that serve different therapeutic fields all over the country.
Awesome.
It's just that we've tried to pull people who have kind of special skills
Mm-hmm.
and place them into positions where they can be the most effective.
Awesome. So that would be the site that you're talking about, more Stanley, or no, more Revelation
Revelation.
Pharma. Okay.
Revelation
That's,
Farm.
and we can put
Stanley
the
has great
link. Yeah.
information.
Yeah, we'll
Stanley
put
has
it.
great information. Their website has it, but again, like I said,
Revelation.
there's a lot of patient education on the Revelation Pharma site.
Well, we can
awesome.
put that in the link as well
Yeah,
below.
Yes, absolutely. So, well, again, thank you for being with us, Greg McKedrick with Revolution Pharma and Berkeley Life. He's on their scientific advisory board. So we wanted to have him on so he can share all the information about that product and how to get better results with what you're doing at home. So if you want to hear anything more about sexual wellness, just let us know, because we're willing to deep dive into anything. And thank you for watching and listening.